What is racism? It's a system that consists of structures and policies. It's ugly. And practices and norms that assigns value, and it determines opportunity that is based on the way that people look or the color of their skin. And this results in conditions that unfairly advantage some and disadvantage others throughout society. Racism negatively affects the mental and the physical health of people, and it prevents them from attaining their highest level of health, and consequently affecting the health of our nation. There's a growing body of research that shows that centuries of racism in this country has had a profound and unfortunately a very negative impact on communities of color. And the impact is pervasive. It's deeply embedded in our society, and it affects where we live, where we work, where we learn, where we worship, where we play, and it creates inequities in access to a range of social and economic benefits, such as housing or wealth or education or employment. And we know these conditions, we often refer to them as the social determinants of health, and these are the key drivers of health inequities within the communities of color. Next slide. So why have we come before you to declare racism a public health crisis? Well, one reason is the pervasive weight that Black, Indigenous, and people of color must bear coping with the concurrence of traumatic events that's rooted in systemic racism. And I can tell you, it builds and it takes its toll. Another reason, unfortunately, we witnessed it even digitally or on our television screens, the outcries involving the tragic deaths of Ahmaud Arbery, Breonna Taylor, George Floyd, and so many others. And the growing awareness of the acts of violence that are targeted on communities of our Black, Indigenous, and people of color. Next slide. Some of the other reasons, racism as that social determinant of health, studies show us that it's associated with negative mental health impacts for Black, Indigenous, Latinx, Asian, and Pacific Islanders. We saw in the pandemic made it clear to us that structural racism threatens the very health and the well-being of Black, Indigenous, people of color. And these communities were disproportionately impacted with death and hospitalization and severe illness. These were all barriers to quality health care. And there were few opportunities to live and to work where social distancing was even possible. Even here in Sonoma County, our system of care is disproportionately serves people of color who experience traumatic experiences of racism. And as a county government, we cannot accept outcomes of institutional racism that lead to poverty, that lead to a lack of access to housing, that lead to a lack of employment opportunities, that lead to possible likelihoods of intersections with the justice system, that lead to racial profiling, that lead to a lack of access to health care. I could go on and on. Maya Angelou said, when you know better, you do better. This time I'll turn it over to my colleague, Dr. Kaplan.
Thank you, Director Rivera. As Director Rivera has pointed out, racism affects health in so many ways. Economic disadvantage and social hostility lead to chronic stress that is experienced by populations of color. And this affects the kinds of risk factors that people experience in their life. The responses to stress lead to significant differences in protective and risk behaviors. And this results in significant disparities in the incidence of chronic disease of populations of color compared to the white population. We also know that racism can affect care directly, resulting in different treatments of care provided to people of color in healthcare setting. A 2016 study found that white medical students, residents, and non-medical personnel held false beliefs about biological differences between white and Black people, including that Black people felt less pain than white people. A more recent study in 2023 of individuals experiencing the most severe kind of heart attack found that patients of color received a lower standard of care. It took longer for them to get to a position of diagnosis, and they were less likely to get critical pieces of care such as an ECG or other processes that are associated with care for myocardial infarction. And finally, we know that the stress itself that is experienced by communities of color directly impacts their biological health. There are these things called telomeres that exist at the end of our genome and our genetic strands. They protect the health of the genome, they protect the health of our genes as cells separate and replicate. And we know that the effects of the stress that is induced on people from racism shortens the length of those telomeres. We've seen that directly in studies. And that Black people, as a result, are much more likely to have incidents of the kinds of illnesses that result from the separation of cells at the cellular level. So that can lead to things like cancer and cardiovascular disease. So next slide. What is the crisis and what does it look like in Sonoma County? Well, this slide is a really good way to start because it reminds us first that we have to center around equity in all the work we do in healthcare, because aggregate indicators of our health in the county can mask significant differences that are experienced by certain populations. As you can see, we did a study in 2012 that measured the health using a particular index of different groups. And then in 2019, we ran that study again. And while the average for Sonoma County went up from 5.4 to 6.2 from that 2012 to 2019 period, if you look deeper into the data, you see that the health of Asian Americans and the health of African Americans actually declined in Sonoma County over that time. So it reminds us that we always have to disaggregate the data to see how different groups are experiencing health. We also know that here in Sonoma County, as Director Rivera pointed out, there are significant disparities in multiple risk and protective factors, such as levels of education, income, home ownership, economic opportunity, and these show up in the data, and we see these disparities significantly in life expectancy. The data show that African Americans have 10 years less of life expectancy in Sonoma County than whites. Furthermore, next slide, if we drill into other areas, we see further manifestations of significant health disparities. The first graph here in the middle shows the percentage of the population without health insurance. And you can see that whites have the highest access to health insurance and that communities of color are far behind. In addition, when we look at our unhoused population through the point-in-time study, we've seen a significant increase in the likelihood that Blacks are going to be homeless in Sonoma County. In fact, Blacks are 4 times more likely than whites to be homeless in Sonoma County. Black people are 2.3 times more likely, and Hispanic Latinx people are 4.1 times more likely not to have health insurance than whites. And Black and Latino children are about 2.5 times more likely to live in poverty than their white counterparts. And with that, I'll turn it over to Nora.
Awesome. So take a deep breath. So in response to this, we are here today to recommend that you adopt this resolution
to declare racism a public health crisis in Sonoma County. In adopting this resolution, Sonoma County will join the nearly 40 other California jurisdictions that have already made this declaration and 250 jurisdictions nationally. Acknowledging the harm racism has caused and is causing to the health and well-being of people of color in Sonoma County is a critical step in dismantling structures and systems that perpetuate racism and contribute to racial inequities in health. However, acknowledgement alone will not catalyze change. We must also commit to taking meaningful action, building on work already underway. DHS has long been a participant and leader in this organization's racial equity work. During the pandemic, we engaged community in the design of our response, standing up the Latinx Health Work Group, and hiring our first dedicated health equity staff member. More recently, we have established a full health equity team to evolve our equity work and strengthen our internal capacity. We have launched our own group of equity champions, the DHS Health Equity Circle, to build momentum and expertise in designing for equity. Later this year, we will finalize our first ever health equity action plan to guide our future work, informed by staff experiences. We have also begun engaging partners in the development of a community health improvement plan, centering and naming structural racism as an area of utmost importance. As a county, we formalized our commitment to race equity when we sent our first cohort of staff to participate in the Government Alliance for Racial Equity back in 2018. As Director Rivera mentioned, since then we have continued to support this commitment by establishing the Office of Equity and adopting racial equity and social justice as a pillar in our strategic plan. These have led to the creation of the County Equity Core Team, the rollout of anti-racist results-based accountability, and the recently launched Foundations in Race Equity training for staff, among many other critical initiatives addressing racial inequity. Every day across the county, countless department and agency staff strive to ensure our services are more equitably accessed and our workplace is more inclusive. For the last year and a half, one such group of staff, the county's Equity Steering Committee, alongside the Office of Equity, has worked to develop the first of its kind racial equity action plan for Sonoma County. This plan is a critical component to our ability to address the health inequities you have heard about today. And as part of this item, we also recommend that the board resolve to adopt, resource, and commit to implementing this plan when it comes before your board later this year. And I invite my colleague Rosa from the Office of Equity to say a little bit more about this plan.
Thank you. My name is Rosa. I am the County Equity Program Manager with the Office of Equity. I'm very grateful today, especially for our partnership with the Health Department and for Director Tina Rivera for inviting us and having quite literally a seat at the table while we're having this important conversation. The adoption of this resolution today and the commitment to the adoption of a racial equity action plan shows your board's commitment to connecting county-wide efforts against racism and willing to go beyond words into impactful actions. This action plan, which focuses on the County of Sonoma as an organization, recognizes that county staff are integral members of the Sonoma County community and represent also the identities and experiences of the different communities that call Sonoma County their home. The plan also recognizes that staff, in particular staff of color, are experts on their own experiences, sometimes of marginalization within the County of Sonoma workers, and therefore that the solutions that the plan presents could only be and are grounded on their feedback. The action plan advances the groundwork delineated by the county strategic plan and elevates best practices that leaders in county departments have begun implementing as examples of actions that we can and should continue to expand as an organization. The health department has been a leader in the operationalization, in operationalizing equity efforts. And this is why we're having this conversation today. So our work together recognizes that only by acting in partnership, supported by data, and by elected officials such as your board, we will be able to make meaningful and take meaningful steps against racism.
So in addition to the adoption of the Racial Equity Action Plan, the resolution recommends that the board take the following actions to combat racism as a public health crisis. Foster a county organizational culture that supports the commitment to achieving racial equity by investing and continually developing an ongoing racial equity learning and leadership program to build anti-racist skills and capacity in the county. Identify and deploy best practices that promote racial equity and address institutional, structural, systemic, and interpersonal racism in all Sonoma County's community-facing services and the internal-facing services that support county operations. Adopt and implement the Health Equity Action Plan, Community Health Assessment, and Community Health Improvement Plan that specifically address structural racism. Advocate for, prioritize, and fund efforts that distribute and allocate resources and investments of time toward anti-racist goals and needs of communities of color. Strengthen relationships and partnerships with community-based organizations that are confronting racism, many of whom are here today. Promote early and ongoing community involvement by engaging the community members and stakeholder groups most impacted by racism to advance racial equity. Implement strategies to ensure that the County of Sonoma workforce reflects county demographics, especially the demographics of people utilizing county safety net services. And ensure the consistent collection, analysis, and reporting of disaggregated demographic data, including race, ethnicity, socioeconomic, health, workforce, and other data to assess, evaluate, and measure progress towards eliminating racial inequities. The role that racism plays in the health of our community is clear. In order to reverse the course we are on, we must act with urgency and precision. We must also understand that we cannot and must not act alone. And I want to reiterate that it is thanks to community advocates and voices that we have gotten more clear-eyed about our responsibility, and it will be thanks to them and their partnership when we succeed.
And final comments. Racism perpetuates health inequities throughout our region. And as the health agency for the region, our county has a responsibility to deal with this issue in order to improve overall health for our residents. So it is important that we publicly and we openly acknowledge that racism exists, that racism has significant consequences, and it is critical for there to be changes in our institutional systems to fight these historical inequities. Your board has started some good work, some very difficult work, some very necessary work. And your board has taken some bold actions. So I encourage you to take another one and approve this resolution to declare racism a public health crisis in Sonoma County. With that, I turn it back over to you, Chair Rabbit.
Thank you very much, and thank you so much for that presentation. Thank you, Tina, personally, for